So, today we're going to talk about something that affects a ton of people but is often a total mystery: irritable bowel syndrome, or IBS. You've probably heard of it, but it can be super confusing. Let's break it all down.
You know those days, right, where your stomach just feels completely out of your control? Maybe you're running to the bathroom, or maybe you can't go at all, and you just have no idea why. If that sounds even a little bit familiar, you're in the right place, because that feeling is really at the heart of what we're explaining today. All right, to really get a handle on IBS, we have to start with what it is, and maybe more importantly, what it isn't. And the key is this term that sounds kind of technical, but it's actually the central clue to this whole puzzle: a functional disorder. So here's the official definition. IBS is basically known for two main things. You've got long-term stomach pain, and your bathroom habits are, well, they're all over the place. But, and this is the absolute crucial part, when doctors take a look inside, they don't find anything physically wrong. No inflammation, no damage, no disease. The structure is fine. The system just isn't functioning right. So let's just hammer this home. When you boil it all down, it comes back to these two core things. One, persistent pain or discomfort in your abdomen. And two, a really noticeable change in your bowel movements. These are like the twin pillars of an IBS diagnosis. And this leads us to the big million-dollar question. If the doctors can't see anything wrong, then what in the world is causing all this chaos? What's behind the malfunction? This is where it starts to get really interesting. Well, the answer seems to lie in this one key idea: hypersensitivity. The best way to think about the gut in someone with IBS is that it's just a little bit extra. It's like its internal volume dial is cranked all the way up to 11. Okay, so the fancy scientific term for this is visceral hypersensitivity. Visceral just refers to your internal organs. So all this really means is that the nerves inside your gut are on super high alert. They have this heightened, almost exaggerated reaction to things that a normal gut wouldn't even notice. This slide just lays it out perfectly. In a typical gut, right, food and water go in, and the system just does its thing. Normal digestion, no big deal. But in an IBS gut, that exact same stimulus, we're just talking normal food and water, can trigger pain and this massive overreaction. The input is the same, but the output, totally, wildly different. To really make this click, let's use an analogy. I want you to imagine your digestive system is like a car alarm. Now, in a normal system, the alarm works like it should. It only goes off when there's a real threat, right? Like someone trying to break in. But in a hypersensitive system, that alarm's calibrated way, way too high. So a completely normal, harmless event, like a single leaf falling and landing on the windshield, is enough to set off this blaring, full-blown alarm. And that is a perfect picture of what's happening in IBS. The normal stretching of your gut from food is the leaf, and all that pain and those chaotic symptoms, that's the alarm. Now, this hypersensitive overreaction doesn't look the same for everybody. It can actually show up in a few pretty distinct ways, which leads to the different types, or as we're calling them here, the faces of IBS. So, what's actually happening on a physical level? Well, this hypersensitivity messes with the movement of your gut. Your intestines use these coordinated muscle waves, it's called peristalsis, to move food along. In IBS, those overactive nerves just throw the speed and the rhythm of those waves completely out of whack. And that brings us to this really clear breakdown. So, if that nerve overreaction causes the muscle waves to go into overdrive and speed way up, you get IBS with diarrhea, or IBS-D. If the reaction is to slam on the brakes and slow everything way down, you get IBS with constipation, or IBS-C. And then, if the signals are just totally erratic and unpredictable, you can get a mix of both, which we call IBS-M. Okay, so we know the system is hypersensitive. The next logical question is, what are these leaves falling on the windshield? What are the common things that actually set off the alarm in someone with IBS? Now, even though the exact root cause of IBS is still a bit of a mystery, we have a pretty good idea of the factors that can trigger an episode in someone who's already prone to it. So what are the usual suspects? Here are some of the biggest ones. First up, emotional stress. This one is huge, and it's all thanks to the super powerful connection between your brain and your gut. Then, of course, you've got certain eating habits, and we're going to dig into that in just a second. Other things like having a bad stomach bug in the past, hormonal shifts, which might be why IBS is more common in women, and even taking a round of antibiotics can all be potential triggers. Let's zoom in on the food part, because for a lot of people, what they eat is the most obvious and immediate trigger. So, let's take a closer look at some of the specific things in our diet that can set off that sensitive gut alarm. So, how does this actually work? Well, things like short chain carbs, think fructose in fruit or lactose in dairy, they can actually pull extra water into your gut. This causes the gut to stretch or distend, and a hypersensitive system reads that stretching as pain. Not having enough fiber can mess with the rhythm of your gut, and greasy fried foods can just be really tough for an already sensitive system to process.
All right, we've covered the what and the why. Now let's get to the really important part. What can you actually do about it? How is IBS diagnosed? And how can you start to take back a little bit of control? First up, getting a diagnosis. See, because there's no visible cause, there's no single blood test or scan for IBS. Instead, it's usually diagnosed through a process of exclusion. That just means doctors have to first rule out all the other conditions that do have a physical cause.
So, doctors are on the lookout for a few key red flag symptoms like these. If someone is experiencing these kinds of things, it suggests there might be something else going on that isn't IBS. The absence of these signs is actually what helps point a doctor towards a diagnosis of a functional disorder like IBS. Okay, so once the diagnosis is made, the management strategy is actually pretty logical. It's a two-part approach. First, you work on identifying and avoiding your own personal triggers as much as you can. And second, you directly treat whatever specific symptoms you're dealing with. And this is what that management toolkit often looks like. For the pain and spasms, there are antispasmodic medications that can help calm those gut muscles down. For IBS-D, antidiarrheal drugs can help slow things down. And for IBS-C, laxatives and adding more fiber to your diet can help get things moving again. The main point is the treatment is really tailored to whatever your primary symptom is.